Community Health Worker Training, Cardiovascular Health and Diabetes. Module 2B, Heart Attack Risk Factors, Warning Signs, and Prevention. Learning outcomes for this mini-module: identify risk factors and warning signs associated with heart attack, and explore strategies for preventing heart attack. Risk factors and warning signs. Risk factors for heart attack include a prior heart attack, a family history of an early heart attack, a father or brother who has had a heart attack before age 55, or a mother or sister who has had a heart attack before age 65, a family history of stroke, diabetes or obesity, increasing age, diabetes, an unhealthy diet. Additional risk factors for heart attack include the person's cholesterol profile. So this is a complicated topic, and we have a whole nother module about it later in the course. But high LDL cholesterol is a risk factor, high triglycerides and or low HDL cholesterol, high blood pressure, smoking tobacco, being overweight or obese, not being physically active, and high levels of stress. So some of these risk factors are controllable and some of them aren't. Obviously, your family history, you have no control over that, but you do have control over whether you're physically active or not. So as a community health worker, you might want to think about how to help people cope with the fact that they have several risk factors, and maybe to help them identify which ones are under their control, right? Which ones can they do something about so they can lower the risk for heart attack. What are the warning signs of a heart attack? Well, it can vary from person to person, but the most common warning sign of a heart attack is chest pain or chest pressure. Some people describe this as a squeezing sensation or a sensation that something heavy or someone is sitting on their chest. The second most common sign is jaw, neck, or back pain. Some people have lightheadedness, nausea, or vomiting. Some people have discomfort or pain in an arm or a shoulder. It can be both sides, but most commonly on the left arm or left shoulder. Other people describe shortness of breath. Now again, different people may have different symptoms, so it can be difficult to know for sure what's going on, but any of these symptoms could be a heart attack. The other confusing thing is that heart attacks in women sometimes look different than heart attacks in men. So the most common symptom of a heart attack in both men and women is that chest pain or chest pressure. But in addition to that and those other symptoms, sometimes women feel faint. They may be very lightheaded, dizzy, or feel faint. They may have a feeling of indigestion or heartburn. They may describe extreme or severe fatigue. And then sometimes they have like a cold sweat. You'll be getting, if you haven't already, some resources that you can share with your clients, including heart attack warning signs, and that resource is in both English and Spanish, as well as a handout about heart attack recovery. Sometimes people who are having chest pain are actually having angina rather than a heart attack. Angina is chest pain or discomfort that a person has if the heart doesn't get enough blood. If the heart's not receiving enough blood, then it's not getting the oxygen and nutrients it needs. A person usually has angina because one or more of the heart's arteries is narrowed or partially blocked. Usually angina is felt as uncomfortable pressure, fullness, squeezing, or pain in the center of the chest. A person may also feel the discomfort in the neck, jaw, shoulder, back, or arms. These feelings are also signs of a heart attack, but if it's angina, the pain or discomfort will only last for a few moments before going away. If they last longer, it could be a heart attack. A person may have angina during physical exercise, when feeling strong emotions, or when in extreme temperatures. For example, running to catch a bus could trigger an attack of angina, while walking might not. Angina is a sign that a person is at higher risk of heart attack and should not be ignored. Let's talk a little bit about prevention. Community health workers can educate their clients on how to reduce the risk factors discussed earlier. Having one or more risk factors does not mean a person will have a heart attack, but it does increase the chances. So community health workers can work with clients on how to eat a healthy diet, being more physically active, stopping smoking, keeping a healthy weight, keeping blood glucose or blood sugar at normal levels, and in general treating diabetes, high blood pressure, and high cholesterol if the client has any of those conditions, and limiting the amount of alcohol. It's recommended that women have no more than 1 drink a day and men have no more than 2 drinks a day. Now you can identify risk factors and warning signs associated with heart attack and explore strategies for preventing heart attacks. The next mini module, 2C, is heart attack diagnosis, treatment, and rehabilitation.